In the 34 years of law enforcement, it was customary for law enforcement to make a phone call to an agency someplace out of the area, wait for the phone call back, and then try to hope that someone was able to respond before you get called out to another call. The system was by and large broke, and I've worked in 3 different states, so I'd say for the majority of that time, for the majority of my career, the system has been broke.
When we were first given the cards and said, hey, call this number if it's after hours, somebody will come help you, we were kind of a little hesitant. We didn't really know what kind of help we would get. I was probably the biggest critic of the mobile crisis unit because we've heard this, throughout my career I've heard that there's this program coming into effect and it's going to be this new and greatest thing. So around February 1st of 2016, we were the first agency to call Spectrum. They were so passionate and so sincere. Within 20 minutes, for the very first time, people were at this person's doorstep willing to help us and to help us help them.
They wanted to get something done, not why we couldn't do it, which is what we were used to hearing in the past. In the first 6 months, 400 plus people were diverted from the criminal justice system and the jail. That was tremendous, and that was just in one area of this county.
Since that time, we've noticed nothing but improvement. Time we've had as little as 8 minutes where someone is shown on site.
I actually responded to their first call that they had in Clarkdale, so I've interacted on a police side. I'm also a part-time therapist at Spectrum, so I get to see the benefits of mobile crisis in clients that I see as well. So if we had a mental health crisis, that could tie me up for 5 to 6 hours. Now, crisis can get there, we make sure everything's safe, and we can be freed up easily in 45 minutes.
On a personal basis, for me as an officer working with Spectrum Healthcare, they're able to de-escalate a lot faster sometimes. They're not in uniform, they don't have a badge, they don't feel like when they see us and they see Spectrum, they're there to get help and we're there to help them.
The law enforcement officer does not have to arrest or spend more time with that individual, because once an individual gets booked into our jail, then a whole cascade of consequences occur because that person is now part of the criminal justice system. That's really the gatekeeper for criminalizing mental illness.
The leadership here at Spectrum recognized what the void was in the community.
I used to work in the emergency room, and these people would come in crisis. They would sit there for hours and hours, and that was not a suitable place for a psychiatric patient.
I think the longest it ever took them to respond was February 1st, 2016, and that was 20 minutes. In my agency alone, the stabilization rate of those people that Spectrum has come, there's been an 81% stabilization rate.